So today I'm going to be showing you guys how to do an injection for a lot of my patients that are doing injections at home. I'm going to show you how to do a self-injection, as well as if you have a wife or girlfriend or friend that's going to inject you because you may have a fear of needles. I'm going to show you how to do it right here. So some of you may get a 1 ml syringe or a 3 ml syringe like what you see here. So if you were on a 200 milligram dose, then that means you're going to go to the 1 right here. And if you're a 300 milligram dose, you're going to go to 1.5. And if you have a 1 cc syringe, then you're going to fill it all the way up to 1, and you're going to use a second syringe to go to 0.5, and that's your 1 dose for 300 milligrams. 1 cc is 200 milligrams, and then 1.5 cc's is 300 milligrams, and less than that if it's 100 milligrams. The thing about the needles is the bigger the number, the smaller the needle, and the lower the number, the bigger the needle. So you're gonna be using an 18 or 20 gauge needle to draw out the solution, and you're gonna be using a 25 or 27 gauge needle to inject the solution. So first, you're going to wipe the solution, okay? And you're going to draw back air, which is, I'm gonna do a 200 milligram dose, which is 1 cc, okay? Then I'm gonna inject it into the solution, and then I'm gonna draw out what I need, which is 1 cc, okay? And so say for instance, you have bubbles. If you had bubbles, you just click it like that and push it back in and redraw, and that will get rid of the bubble. And then once you do that, you're gonna replace it, okay? And you're gonna toss away into your sharps container. And this right here is the one you're gonna be injecting with, which is the small needle, the 25 or the 27 gauge. If you're gonna be doing it for someone, this is what you're gonna do. So when I'm injecting, I'm gonna use that alcohol pad to go right here in the gluteus maximus here, okay? And you're gonna go in a circular motion. And as you can see with this patient, they don't have any pressure on this leg at all. So all the pressure is on the opposite leg that you're not injecting. And once you do that, you're gonna squeeze it like this here, and then you're just gonna inject straight in, boom. Just like a game of darts, nothing to think about, you just do it, and then you inject. And that's it. You shouldn't hardly get any blood return. You may get a little bit of blood, but most times you won't get anything at all. Also, when it's 1 cc, which is 1 milliliter, you can also go in the arm as well. So if we were doing his arm, we would do the same thing. So you would take the alcohol wipe. This is the deltoid muscle right here, a circular motion, and you can just squeeze it here and then inject. If you were doing it at home by yourself, you can go in your arm here, wipe it with alcohol. You wanna have this arm just relaxed, and then you can just inject just right here in the deltoid. And if you're injecting in the bottom, this is the leg that I'm using. So this, I'm not gonna have any pressure on this foot at all. So I'm going to wipe it with alcohol here, and then all I do here is inject right here in the gluteus muscle. And you can also do the vastus lateralis, which is, in other words, the quad muscle. You can do 1 to 2 cc's here as well. So you have multiple options as far as injection. And so each week you want to switch positions. So if you would do right shoulder 1 week, you can do left shoulder the next, and then you can do the right hip and then the left hip, and that's for your whole month. You won't develop any scar tissue or anything like that, but you just want to make sure you wash your hands before and after, wipe off the solution with alcohol, and also wipe your skin with alcohol as well.